The liver plays a behind-the-scenes role in shaping how our bodies respond to nearly every medication, supplement, and stimulant we consume, including something as familiar as caffeine. It's the central processing unit for chemical clearance, determining how quickly a substance is broken down, how long it stays active in the body, and whether it becomes more or less potent through metabolism. This complex biochemical responsibility often goes unnoticed until it doesn't. When liver function is compromised, the ability to safely metabolize drugs or stimulants like caffeine is reduced, potentially leading to stronger effects, delayed clearance, or unexpected side effects. Yet this vital connection is rarely part of public awareness, even among those actively managing their medications. Most drugs, whether taken orally, through injection, or via skin patches, pass through the liver for processing before they enter systemic circulation or are excreted. This transformation, known as hepatic metabolism, occurs in two phases. In phase I, enzymes, mainly from the cytochrome P450 family, modify the chemical structure of the substance. This can either activate the drug, as with prodrugs, or begin its breakdown. In phase II, the liver adds molecules like sulfur, methyl, or glucuronic acid to make the substance more water-soluble, allowing it to be excreted by the kidneys or in bile. The speed and efficiency of this process determine the drug's half-life, peak concentration, and potential for toxicity. Take caffeine as a simple example. After a cup of coffee, your alertness doesn't just depend on the caffeine content. It depends on how well your liver metabolizes it. This is primarily handled by the CYP1A2 enzyme. Some people have genetic variations that make this enzyme work faster or slower, which is why some can drink coffee late at night and sleep soundly, while others get jittery after half a cup. But liver health also plays a huge role. In people with fatty liver, hepatitis, or cirrhosis, enzyme activity slows down. Caffeine stays in the system longer, and sensitivity increases. The same logic applies to many medications. A standard dose for one person might be too strong for someone with reduced liver function. This becomes particularly important with drugs that have narrow therapeutic windows, meaning there's a fine line between an effective dose and a toxic one. Painkillers, blood thinners, antiepileptics, antidepressants, and even some antibiotics fall into this category. If the liver can't process them efficiently, levels can build up in the blood, leading to overdose-like effects even when taken as prescribed. In some cases, the liver turns certain medications into more active or more toxic forms, so impaired function can lead to either underdosing or dangerous accumulation. That's why in hospital settings, liver enzymes and clotting times are often monitored closely in patients receiving complex drug regimens. However, in everyday practice, many people with early or mild liver dysfunction are not routinely screened or warned about this issue. Someone with non-alcoholic fatty liver disease or mild hepatitis may be taking multiple medications and supplements, unaware that their liver's ability to process them is already compromised. They might experience fatigue, dizziness, headaches, or digestive upset without connecting these symptoms to slower drug metabolism. Over time, this can contribute to medication intolerance, adverse drug reactions, or even liver stress from repeated exposure to drug metabolites. This underscores the need for greater awareness, not just among clinicians, but among the general public. Liver health should be part of the conversation when starting any new medication, especially for those on long-term regimens or with existing liver concerns. Dosage adjustments may be necessary, and alternative drugs that bypass the liver, via renal or gastrointestinal clearance, may be safer options in some cases. Pharmacogenetic testing, which examines how your genes affect drug metabolism, can also offer insights into how efficiently your liver enzymes are working, providing more personalized and safer treatment strategies. On a more hopeful note, liver function is remarkably responsive to lifestyle changes. Supporting liver detoxification and enzyme activity through proper hydration, antioxidant-rich foods, and nutrients like glutathione, B vitamins, and magnesium can enhance metabolic clearance. Avoiding unnecessary polypharmacy, limiting alcohol, and reducing processed food and sugar intake can reduce the liver's chemical burden, improving its ability to handle medications and stimulants more smoothly. At its core, the liver doesn't just filter, it interprets. It reads the chemical language of the substances we ingest and decides what to activate, what to neutralize, and what to eliminate. Every drug we take, every cup of coffee we sip, is processed through this sophisticated biological translator. When we care for the liver, We're not just protecting our metabolism, we're safeguarding our brain, heart, and nervous system from the side effects of accumulated or poorly metabolized compounds. So whether it's managing chronic medications or simply understanding why some people react differently to caffeine or painkillers, liver health is central. It's not an afterthought, it's the gatekeeper. And the more we recognize its role, the better we can tailor our choices for both safety and clarity of mind.